So a big thank you to all our COVID warriors and the ones that will join the war against COVID from GenPact. With that, I'm going to hand to our very own Vidya Srinivasan to address all of you.
Yeah, hi, good afternoon, everyone. Good afternoon to all the COVID warriors, and I hope the future ones, because we truly want lots more of you here. Also, all our partners, with our people we have partnered with, StepOne, and as obviously the government of Delhi with whom we have worked. Giving is a way of life for us. We've done this in many areas, and I think what we do in giving is really take the learnings which we apply to our clients, which help them become future ready, transform, and we just take those learnings and apply them in the social space. That's exactly what we are doing with the whole pandemic and the COVID situation, especially with the agencies that we work with. It started off in April when we got an opportunity to work with StepOne as well as the Delhi government to help the ecosystem on managing a part of the COVID which is closer to our skills. And StepOne obviously is an organization that is working on COVID helplines and support at a much larger scale. And so it was an honor for us to get that opportunity to work with them. And since the time we have started, we have had almost, I think, 600 people who have volunteered, about 596, through this whole journey of the last 3 to 4 months. And we currently have almost 330 odd people still who continue to support 24/7. Some of them, and we keep getting some videos of people who've recovered and how we've really truly touched lives, which is really what it eventually is all about. And I think the important piece is that the people who are contributing are doing this over and above their regular jobs. So they've taken out the time, they believe in it. And I think that's so a huge salute to all of you who have been doing this. I think you truly make us proud. And I just do want to, before we get into the thick of things, this is really a pitch for all the 1.8K people who are on this call. Please do volunteer. We just need 1 hour a week of your time. Honestly, it's not a lot. You can take it out from some other time and do something. I mean, become a part of this movement. The more number of people who step in, the better it is for us. And we will obviously hear from StepOne and the Delhi government because they're much closer to the ground on all of this. And thank you for everything you've done. And I'll just pass it back to the panelists. And again, one more shout out to all of you, and we need more of you in this. Thank you.
Thank you so much, Vidya. I would like to now introduce Dr. Nihad Nilofar, an MBBS graduate from Ramya Medical College with more than 10 years experience in clinical and non-clinical fields of medicine, and Professor Sunil Raina, Professor and Head of Community Medicine, Dr. RP Government Medical College, Tanda National Convener, Organized Medicine at for addressing us. Dr. Nihad Nilofar, Professor Sunil Raina.
Yes, I'm there, but there are probably some network issues here.
If you could go off your video, actually the voice improves. While we like to see your face, but if you go off video, video consumes a lot more bandwidth. So
okay, let's do that.
Thank you.
Okay. I think this is fine now.
Yeah, much better. We can hear you.
Okay. So should I go, or Dr. Nihad needs to go?
Dr. Nihad first. Thank you.
Thank you.
You give but little when you give of your possessions. It's when you give of yourself that you truly give. Khalil Gibran. Good evening, everyone. I'm Dr. Nihad Nilofar from Bangalore. I started volunteering in March when I was bang in the middle of a health crisis in the family. I went from feeling frustrated at not being able to do anything for my mother to a deep sense of satisfaction of having helped hundreds of unknown people. Volunteering gave me a chance to be a part of something bigger, and use my skills and knowledge to assist people all across India. I've always been a think in English, talk in English type of person. But now my Kannada and Hindi has improved. Of course, there have been incidents where I mix up the words of all the languages and give my family a good dose of laughter. Steve Jobs said that the people who are crazy enough to think they can change the world are the ones who do. I believe we are among the crazy ones. I started volunteering because I believe every good deed is rewarded. I am collecting prayers for my mother. And recently, a cousin pointed out to me that the thanks a patient says at the end of a call is also a form of prayer. So I would encourage everyone to continue volunteering and collect your rewards. Let me end with another favorite quote. Volunteers don't get paid not because they're worthless, but because they are priceless. Thank you, everyone.
I couldn't agree more. Professor Sunil Raina?
Yes. Thank you, Lavanya. As I could read it, I may be wrong with it. I have, as I said, there are some issues with it. But anyways, thanks a lot for this effort and what StepOne has been doing. I've been associated with a few of StepOne's initiatives, and I feel that they are doing a wonderful job. And when StepOne teams up with governments, the horizon expands to unlimited proportions. Delhi has been at the forefront. Delhi has shown us the way in a few major steps. We were afraid of Delhi. We feared that Delhi will bomb because of the fact that the pandemic will grow up in unprecedented numbers. But Delhi did manage it well because of that, their 5-point strategy of testing, tracking, tracing, monitoring, treatment. They did it so well. Now probably it's time to move from that phase 1 of pandemic, wherein we did these 5 T's, to phase 2 of pandemic, wherein we need to move to the 3 P's of the pandemic, which are plan, predict, and prepare. So we probably need to plan for future so that whenever we have an epidemic or a pandemic of this nature, we are having something in our hand to tackle it. We don't need to search for things because we won't have StepOne at all times to take care of these things. We will need plans in place. Second is we need to be able to predict. With this current pandemic, we need to be able to predict the hotspots, the high-risk groups, the risk areas. And with this prediction, we should be able to prepare the mitigation plans. We should have something in hand to mitigate this plan. And I think probably StepOne needs to move to that phase of the pandemic again. So while they at phase 1, they volunteered and helped people take treatments. Now they need to move towards these prediction exercises, come out with valid data, analyze their data, come out with those databases, and predict these are the risk groups so that we can mitigate them very well. Thanks a lot. Thank you once again for giving me this opportunity.
Thank you so much again, Professor Raina. I would now like to call upon Padma Shri awardee Professor Dr. S. Natarajan, President, Organized Medicine Academic Guild, OMAG. Welcome.
Thank you, Lavanya, for the opportunity, and thanks to you and Vidya. And can I share my screen for just a slide?
Yes, you can. I think.
Yes. You can see the screen? Can you see the screen?
Yes, we can.
Okay. So thank you very much. As the president of Organized Medicine Academic Guild, just now our expert Dr. Sunil Raina spoke, and we also have Dr. Ishwar Gilad as our Secretary General, and we are trying to propagate that SMS and 3H, that is social distancing, wearing masks, and using sanitizer. And 3H, I call it as a happy, healthy, and holistic life. So I think the 5-point program from Organized Medicine Academic Guild is to manage COVID in India and in Delhi is trust experts, move from lockdown to public health and primary care approaches, Make sure, say, every citizen gets a mask. All medium to high risk place to supply free masks through mask points. And the three, track the virus, use technology, test, track, isolate using technology. Four, prepare the hospitals, increase capacity, make uniform protocols available to all the healthcare workers. And five, involve community and mobilize community to follow social distancing and hand hygiene. And that's what is called as a SMS. So I take this opportunity to thank you asking us to take part. And I think we have 20 medical organizations and we have about 1.5 lakh doctors involved in this. Thanks to Step One for involving us, and we are there to do a service across India. Thank you very much.
Thank you so much, and I wanted to thank our Honorable Chief Minister for joining us today. Okay, thank you so much, Dr. Natarajan. In our next session, we will have Step One team, T.S. Raghavendra Prasad, aka Rags, an engineer and a serial entrepreneur, founder of QuickWell, a healthcare technology firm, and he has provided leadership to the Step One team. Dr. Shuchin Bajaj, a Chevening scholar, is the founder, director of Ujala Cygnus Hospital, a pioneer healthcare outfit in 4 states of North India, providing high quality care primarily for the underserved communities.
Thank you very much, Lavanya, and warm greetings to all our friends here, and namaskar to the Honorable CM and Shri Raghav Chadda, who have very kindly joined us. Atishi ji is also about to join. I think she'll be here in the next 5 to 10 minutes. She's stuck in some work right now. I just want to begin by sharing the Delhi story on how it started off and where we are now. And then I'll let Rags take over and talk about the journey of Step One all across India and where we want to go in the future as well. So I remember very clearly it was end of May, and there was a mad scramble for beds going on in Delhi at that time. We were seeing a lot of messages on social media, on television, on various media reports that you're not getting beds, you're not getting enough beds. People are in ambulances for hours together, and there was this mad scramble for helplines. Nobody's picking the helplines. So we were just lucky enough, I think, at the right time, at the right place. We got talking to the health minister, Shri Satyendra Jain, and offered our help because we had thousands of doctors on the platform. So we thought that we would be doing more of helpline work. We offered that we'll manage the helplines, but he had a brilliant idea that, he said, no, just managing the helplines will not be enough, because there is so much panic and undeserving patients are hogging the hospital beds, and the really deserving ones don't get to the hospital at all. We want you to call each and every patient who's been detected positive and see that how you can help him, how you can counsel that patient, how you can make sure that that patient gets the best possible care that is there. So we had our first conversation, I think, on 29th of May, and we had launched on 1st of June, 2nd June morning. I think we didn't have any doctors on the platform yet, and I was doing the first calls at 7 o'clock in the morning to the COVID patients. That worked very well because we started speaking to each and every COVID patient as soon as the report came in. So it was not just the panic that was taken care of, it was also as a learning to us that we could prevent super spreaders from just going about their daily work for the next 1 or 2 days till they finally could get to their reports. And I think that helped us a lot in containing the spread of the virus, because as soon as the report got loaded onto the ICMR platform, we got access to it through an amazing team of volunteers of Aam Aadmi Party. I am one as well, so I am a grassroots level worker at the Shakur Basti constituency, so really proud of working with all of them. So we got immediate reports that these are this hour's positive patients, and we could immediately start dialing them and calling them up. So that I think helped a lot. And then a few days later, at the middle of June, end of June, I think, a similar mad scramble started for plasma. So there was this, because ICMR approved the off-label use, so every hospital started doing plasma therapy. And then there was this again, a lot of things on social media, and there was apparently a black market going on how plasma was being sold across patients and donors. So again, we had this idea that since we were already in touch with a lot of COVID patients, we had developed bonds with them, our doctors were talking to them on a daily basis, that we could maybe motivate these patients as prospective donors. So we again thought of starting a donor recipient matching registry, but again, I think the Delhi government and Atishi ji, Raghav ji, and the CM himself had this wonderful idea again that, you know, instead of doing a donor recipient matching, we should open a plasma bank, which will be of much better use. And I think that worked out very well for everybody, because that concept now is being copied all across, not just India, but in various other countries as well. And that again was launched very, very quickly. I think 3-4 days of starting conversation and started immediately. And I can't thank enough the volunteers working with StepOne, the mental health counselors, the doctors, the tech team that, you know, launched these products within minutes. The entire Genpact team that took care of everything. I think from incoming helplines to outgoing to plasma donation to Uber bookings for donors to managing the DRM process to escalating the serious cases to the DSO teams. So I think Genpact was the sutradhar of everything, holding everything together. So thank you very much to you all. And it's been a wonderful experience, just rekindled our faith in humanity, on how people have just gotten together without any consideration for money or recognition or name. They've just come together and worked day and night calling patients. I'm amazed at the doctors. You know, they've been really working hard day and night, the Genpact team as well, as I said earlier. And most of all, I think the Delhi government representatives and the AAP volunteers, especially Atishi ji and Raghav ji, who've worked with us standing shoulder to shoulder, just like volunteers. They've been part of each and every WhatsApp group, even answering the smallest of queries, running around immediately as and when needed. So big thanks to everyone here. And I'll ask Rags to just tell us more about the nationwide journey as well. Thank you.
Thanks a lot, Shuchin, for reliving the circumstances in which we started Delhi. I think, as Shuchin said, we were not doing what we did in Delhi before we started. We were mostly doing pre-COVID screening on helplines, and but now after Delhi, we are doing more of COVID positive management, which is COVID positive triaging or outcalling, the COVID positive helpline, home isolation monitoring, and plasma donor management. That has actually become StepOne's focus. Out of the 13 states in which StepOne is live today, in 6 states we are doing COVID positive management, and the 4 new states where we will be launching very soon, COVID positive management is what we will be starting with. So that is because this is what we have learned in Delhi. In Delhi, we have had many learnings, and I want to mention a couple of them. I think the first is the impact of having the doctor speak to a COVID positive patients as soon as they turn positive. I think that is something nobody could have predicted will be so hugely impactful. It ensures that patients are staying at home and thereby preventing the spread, as well as they're not panicking, and only the people who really need the critical resources like hospital beds and ICU ventilators are prioritized, and only the critical resources are well organized. I think the entire credit for making that impact happen goes to the doctors on the StepOne platform. I remember the days when there would be a surge in cases. I think we have gone up to 3,800 cases in a day. and doctors would stay up all the way up to 2 a.m. Talking to patients, and resume back again from 6 a.m. in the morning. So it is this selfless service which is inspirational. But that it was a lesson that we learned, that we are trying to incorporate across. The second lesson that we learned is what Delhi was the first state to make home isolation, embrace home isolation and make it work. So they did everything to make home isolation work. I think giving the first of all, having a very efficient ambulance network, which is providing first world turnaround time, in the best turnaround times that you can ever get from an ambulance network is available right now in Delhi. And with third world empathy, or the Indian empathy, I should say. There were instances where the patients would request that their caretakers also go, and they would organize also a taxi to go behind the ambulance. It's amazing the way the ambulance network was run in Delhi. They also, I think, giving pulse oximeter to every home was important. But one of the things that we learned from Delhi is the importance of having a COVID positive helpline. When the doctors would call the patients would have so many questions for the doctors. It would take 10 to 12 minutes each call. I think on average was about 12 minutes in Delhi. And the doctors, when they were about to keep the call, they would tell them, don't worry, if you have any issue, if any time the symptoms change, call this number 1-800-111-747, and you can get access to a doctor. And that would totally change the way the patient is feeling about home isolation. They would get so much confidence. And this whole helpline was completely manned by the Genpact warriors. And of course, ably supported by the COVID marshals and all the StepOne doctors who would also help the Genpact warriors when medical support was needed. But manning this helpline 24/7 by volunteers is probably something that has gone a long way in saving so many lives, numerous lives. I remember even at 3 a.m. in the morning, the inbound group would be active with so many messages being exchanged, so many calls being made, because there were patients who were breathless, who were calling, and the Genpact warriors were really able to help all of them out. So when I think the estimate is that at least 2,500 lives were saved by this helpline. And the fact that just by volunteers we were able to handle 4,000 calls a day, which was the peak number, is also a tremendous effort. Around the time we started in Delhi, I think Honorable Chief Minister of Delhi, Shri Kejriwal ji, had made an estimate that we will have about 5.5 lakh cases in Delhi. We ended up with a lot less. I think over 3 lakh less. And I feel all of you have made a contribution towards that. The StepOne volunteers, all the StepOne partners, specifically Genpact has made a huge contribution. The COVID marshals, Shiros, Uber India, Red FM, everyone has gone a long way in making this happen. But all of this could not have been possible without the steadfast clarity with which the whole strategy was executed by the Delhi government. They basically let us function in an extremely seamless manner, that we felt that we were working as part of the government, and we felt that Atishi ji and others were actually working as volunteers with StepOne. It was amazing. So irrespective of state or regional boundaries, citizens from all over the country coming together and working with the government has really makes me feel proud as an Indian today. So I would like to call upon someone who has worked tirelessly and stood by us and made the whole effort in Delhi successful. She herself has been a COVID positive patient, and even when she was COVID positive, she was responding to WhatsApp messages and helping us and helping doctors. Atishi ji, if you're already there, over to you.
Atishi ji, before you begin, and we're really looking forward to listening to you speak, I just wanted to extend a very warm welcome to our Honorable Chief Minister and Raghav Chadha ji for joining us today. Back to you, Atishi ji. I believe Atishi ji is running slightly late. Raghav ji, if you could begin, we would be delighted to hear from you. Raghav Chadha ji has been the national spokesperson for the AAP and MLA for Delhi government. He is a chartered accountant by profession. His intervention in setting up and being the primary troubleshooter for the ILBS Plasma Bank has saved many, many, many lives, with him being at the forefront of the administration of holding ILBS efficiently. We really look forward to hearing from you.
Can you hear me?
Yeah.
Am I okay? Am I visible and audible? Ji, yeah. Thank you so much for having me on this call. Since the Honorable Chief Minister, who's pressed for time, has joined this call, I'm going to keep my comments very brief. I would first of all like to congratulate StepOne as well as Genpact for the extraordinary service that they have done, particularly when it came to the outbreak of COVID-19 in Delhi. I have had the opportunity of working closely with StepOne, Dr. Shuchin, Rags, Derek, and all of the lovely people out there at StepOne. And you know, Delhi Plasma Bank, which was the brainchild of the Honorable Chief Minister, the success of this bank would not have been possible without the support that we got from StepOne and Genpact. We certainly realized that the most important part of getting a donor to come and donate was convincing that person, dealing with his apprehensions, addressing his concerns, mitigating all the fears and issues that he had. And I think that is where StepOne as well as Genpact came in, and they played a very, very crucial role. And they are, one of the forces responsible for making Delhi Plasma Bank so successful. And as somebody who has worked on this as a volunteer, I can tell you that Delhi Plasma Bank is a project which is and still continues to be very close to the Honorable Chief Minister's heart. He every single day he used to follow up on every minor detail of the bank with respect to how many donations happened, how many issuances took place on that day, whether the donors are facing any issues or not, how smooth is the process. And as a result of which, it has now become, a textbook example, and states after states are copying, emulating the Delhi Plasma Bank. And from the bottom of my heart, as a Delhiite, as an elected representative, I would like to thank all of you at StepOne, hundreds and hundreds of volunteers at Genpact for making this so successful. Thank you so much. It was a pleasure working with all of you.
Thank you so much for giving us the opportunity to work with you. But without much ado, I would like to extend a very warm welcome again to our Honorable Chief Minister of Delhi, Shri Arvind Kejriwal ji.
आप सब लोगों का बहुत बहुत शुक्रिया। और आज आप में से कई लोगों को मैं स्क्रीन पे देख रहा हूँ, अदरवाइज StepOne के बारे में मैं राघव से, अतिशी से, जैस्मिन से, विजय से, इन लोगों से सुनता रहता था। स्पेशली अब डॉक्टर शुचिन बजाज के बारे में, उनका नाम तो मैं सुनता रहता था, लेकिन आज सामने मैं स्क्रीन पे उनकी शक्ल भी देख रहा हूँ। आई हैड नेवर मेट एनीवन बिफोर। मैं आप सब लोगों का तहे दिल से दिल्ली की जनता की तरफ से शुक्रिया अदा करता हूं, जिस तरह से आपने सेल्फलेस तरीके से और इतनी सिंसेरिटी के साथ दिल्ली की जनता की सेवा की पिछले कुछ महीनों में। और दिल्ली का जो मॉडल है वो डेली मॉडल खूब चर्चा हो रही है। वो मॉडल यही है कि इसमें सिविल सोसाइटी, गवर्नमेंट, सारी गवर्नमेंट, सिविल सोसाइटी, सारे इंस्टीट्यूशंस, सब लोगों ने साथ मिल के काम किया। और जब सबसे पहले स्टेप 1 के साथ काम शुरू किया था, हम लोग यही सोच रहे थे कि हो पाएगा नहीं हो पाएगा, कितने डॉक्टर्स की ज़रूरत पड़ेगी, कितने डॉक्टर्स की ज़रूरत नहीं पड़ेगी। बट मुझे लगता है कि आप सब लोगों ने जिस तरह से मेहनत करके काम किया, 3-4 दिन के अंदर ही मुझे याद है 3-4 दिन के अंदर ही सब चीज़ें ऑन ट्रैक हो गई थी। और पेशेंट्स के साथ जो आपकी जो फर्स्ट कॉल पेशेंट्स के साथ होती थी, वो बेसिकली कॉन्फिडेंस देने के लिए उसको कि भाई हम हैं, आप चिंता मत करना, हम आपका ख्याल रख रहे हैं। हमारा होम आइसोलेशन का मॉडल भी जो है वो उसका सक्सेस का एक बहुत बड़ा कारण स्टेप 1 है, जिसने जो फर्स्ट कॉल करके पेशेंट्स को तसल्ली देता था। अभी मैं सुन रहा था कि रात को 2-2, 3-3 बजे आप लोगों के पास कॉल्स आते थे और आप वो अटेंड किया करते थे और पेशेंट्स को कंफर्ट देते थे। और उसके बाद जब प्लाज्मा बैंक भी शुरू हुआ, और प्लाज्मा बैंक में भी आप लोगों ने काफ़ी सपोर्ट किया, एक एक पेशेंट को, एक एक रिकवर्ड पेशेंट को समझाने में कि कैसे प्लाज्मा देने से कोई प्रॉब्लम नहीं है और प्लाज्मा देना अच्छी बात है। तो मैं आप सब लोगों का तहे दिल से शुक्रिया अदा करता हूँ। और मैं अभी जब आप सब लोगों को सुन रहा था तो मुझे यही था कि अभी ये कोई फेयरवेल मीटिंग तो नहीं है ना, वी आर गोइंग टू कंटिन्यू, एम आई राइट? वी आर गोइंग टू
This is to get more volunteers for you, so we're actually asking more of our employees to actually participate.
Okay.
So you are actually
Okay,
a brand ambassador to sell this.
ओके, सो सर्टेनली अब हमारी तरफ से भी अगर कुछ ज़रूरत पड़े आपके वॉलंटियर्स बढ़ाने के लिए, मुझे याद है एक बारी शायद एक वीडियो वो तो किया था, एक वीडियो जारी किया था हम लोगों ने, सो दैट यू गेट मोर वॉलंटियर्स फ्रॉम अक्रॉस द कंट्री। सो आई थैंक यू सो मच एंड इट्स बिन लवली वर्किंग विद ऑल ऑफ यू एंड वी विल कंटिन्यू वर्किंग लाइक दिस। थैंक यू।
Thank you so much, Honorable Chief Minister. With that, we will now acknowledge our volunteers who have made this possible. Apologies, we will launch the Step 1 Impact Report, and I know that we're all excited to see this.